Okay, going to show a bunch of different exercises specifically designed for core muscle injuries. These used to be called sports hernias. Core muscle injury is the appropriate term now. So basically just follow along with me and Harper here. I'm going to do some leg lifts with a little bit of adductor squeezing. Remember, the muscles involved here are anything that attaches to the pubic bone. So it could be rectus abdominis or your ab muscles. It could be adductor longus or your groin muscles. So you're going to be doing a bunch of protected trunk flexion or hip flexion, as well as protected adduction, mostly using here really light active range of motion and or isometrics in combination. Isometric means basically squeezing or contracting without movement. As you can see here, doing a variety of different leg lifts depending on the pain level, and just using a ball to isolate some of these motions and focus in on that core muscle rehab. Here, just using the ball along with some clamshell openers, a combination of active rehab with, again, some isometric contractions. And as tolerance allows, I'm trying a little bit more range of motion to see if we can open up that adductor muscle as well. So we do a little activation, then a little elongation, see how that feels. Of course, we're always doing this to pain tolerance. Speaking of opening up, I want to check that psoas or hip flexor. A lot of times in these core muscle injuries, this psoas will be involved too, or at least some of the structures in and around that inguinal ligament. We're going to open that anterior hip capsule up and see how that feels. As long as those go all well, then we're going to start doing some active range of motion. Again, no weight here, just body weight squats to depth. See how that feels. Of course, if it's painful, don't do those. And then getting a little bit more aggressive as we go here, some lateral squats just to see how that feels, opening up that adductor muscle a little bit. Taking the stance wider as I go, seeing how that feels, playing in that different position, and seeing if we can get the muscle injury to respond positively to movement. After all, movement can be medicine. Lastly, a little bit of a Cossack squat. Obviously, this is the last step. You wouldn't want to progress to this if the adductor or groin muscle is bothering you. These can be especially tricky, so make sure you're working with a local practitioner.